In a medical emergency, every second counts. The crash cart is designed to be the ultimate life-saving toolkit, fully stocked and ready for immediate use when a patient's life is on the line. In this video, we'll give you suggestions on the items to include so you have what you need to respond quickly and effectively during critical moments. This is a suggestion of how to put together a crash cart. Your crash cart is going to vary depending on your specialty, location, and resources. So please use this as a starting point or guide on things you can consider for your crash cart. For cardiac arrest emergencies, having an ambu bag handy is important. Access to your defibrillator with pads will be something to consider. You want the equipment to be easily accessible, ready to go at any moment. This will require processes in place to check the equipment regularly to make sure the defibrillator is charged and functioning properly. In this example, we can see that the first drawer has the medications. You have adenosine for SVT, amiodarone for VTAC with a pulse along with the filters, amiodarone for cardiac arrest, 300 milligrams for the first and 150 for the second. You also have an anaphylaxis kit, which includes methylprednisone, Benadryl, and epinephrine for IM injection. There is atropine Bristol-Jets, 1 milligram each. Remember, the total dose is 3 milligrams for atropine. There are 2 calcium gluconate vials, 1 dextrose amp of 50% dextrose, 2 diazepam vials for seizures, 1 dopamine drip for hypotension, 10 epinephrine syringes, 2 flumazenil vials for benzo overdoses, 3 Keppra vials for seizures, 2 lidocaine vials, 100 milligrams each, 2 magnesium vials, 1 milligram each, 2 metoprolol vials, 5 milligrams each to reduce heart rate and rapid AFib or flutter, 2 naloxone 4 milligram vials for opioid overdoses, 2 norepinephrine or Levophed vials for mixing a drip for hypotension, 2 normal saline bags of 100 milligrams each. Remember, you will need to work with your pharmacy colleagues to adjust this recommended list for your specific needs. In this second drawer, all the items needed for IV access is neatly organized. You have angiocats for IV access, syringes and needles for drawing up meds. There are flushes and ABG kits. This may not be enough to get you through a long code scenario, so think about having a backup IV cart with additional items. This third drawer has code sheets for documenting the cardiac arrest. This may still be used even if you're in a electronic documentation system. You can use this drawer for storing sterile gloves and suture kits as well. The fourth drawer has normal saline and dextrose solutions, IV tubing, a dopamine drip for hypotension, and McGill forceps that can help guide the ET tube and can also be used for removal of foreign bodies in the airway. The fifth drawer in this example has a suction setup and regulators for areas that don't have this built into the room. There's a triple lumen catheter kit and a second ambu bag in this big compartment. In addition to a crash cart, depending on your area, you may want to consider having a separate difficult airway cart with items you may need in a respiratory emergency, or you can incorporate them into your crash cart. In this example, you can see there's a separate crash cart, and in this drawer, they are showing you different types of suction catheters in various sizes. The next drawer has LMAs and ET tubes of various sizes. A rapid sequence intubation kit like the one shown here is a great resource for rapid intubations. The medications that can fit into a small kit that may be useful are succinylcholine, 1 pre-drawn syringe of 200 milligrams, etamidate, 1 vial of 20 milligrams, and vecuronium of 10 milligrams. You will need to include a laryngoscope and a light source. Make sure to check that the light source is working before use. You will also need extra batteries in the crash cart. The blades you will need to have available for intubation are Max, which has a slight curve, and a Miller, which is a straight blade. You can also have bougies to help guide the ET tube into the airway. Your physicians may prefer to use a glidoscope for intubation. There are several size blades depending on the patient's weight in kilograms. Extra blades, bougies, and rigid reusable stylets and single-use eyelets for the gyroscope are good to have readily available, as this may not all fit in your code cart. You will want to have CO2 detectors for ET tube confirmation, and you can have CO2 monitors as well, along with the tubing available for monitoring the patient post-intubation. Other items you may want to consider are cricothyrotomy system kits, stylets, oral airways, and more CO2 detectors. The following is a maintenance routine that should be completed regularly. You will decide for your organization how often you want this done, and you want to make sure that you're aligning with your regulations. Things to include in your process are checking for expiration dates on medications, making sure your expired medications are removed and replaced. The defibrillator pads do have expiration dates on them, so you want to make sure that they are checked, and if the pads are opened, they're discarded. And you want to check the battery charge on your monitor or AED, and this should be done regularly so that you have a monitor ready to go at all times. I hope you found this helpful to get you started on putting together your crash cart.